Without any further ado, we're going to be introducing our first venture of the accelerator and who's going to be presenting today. Really happy to have Rodolin Joseph, the founder and CEO of Medsembly. Rodolin, you could start to take yourself off mute. Medsembly is an employee engagement, learning, and wellness tool that helps healthcare companies stay connected to their team. Rodolin, you can take it from here.
Thank you, Alessandro, and good morning, everyone, or good afternoon. Thank you so much for having me. I'm going to share my screen. Okay. All right.
Looks great.
Okay, perfect. Hi, everyone. My name is Rodolin Joseph, and I am the founder of Medsembly. The world population surpassed 8 billion in November 2022. Baby boomers are aging, Generation X are in their 50s, and millennials are now in their 40s. There will be a need for 18 million new healthcare workers by the end of the decade. Is the sector prepared to meet this demand? Unfortunately, no. Despite an aging and growing population, 20% of healthcare workers are presently leaving the sector, with the leading causes being burnout and lack of support. And this has cost a $20 billion loss to the medical industry in 2021 alone. But worse is a threat to quality patient care, specifically for underserved communities. This hit home for me the most during my time working in New York. I was one of the hundreds of healthcare workers to travel to New York during the COVID-19 pandemic. I realized how big this problem was at a grassroots level. In addition to working 12-hour nights, 6 days a week, I also hosted a webinar to help students get shadowing credits for PA school. What started out as a weekly webinar turned into hundreds of messages from students voicing their frustrations and setbacks that hindered them from pursuing a career in medicine and potentially turning away from healthcare, which is the last thing that we want. Hi, my name is Rodolin Joseph, and I am the founder of Medsembly. I may not look it, but I have been in the medical field for 15 years, which is nearly half my life. I got started as a licensed practical nurse in high school and became a physician assistant in 2016. Healthcare is ingrained in me, and witnessing the direction we're headed in motivated me to create Medsembly. Medsembly is helping students and professionals from falling through the cracks as they navigate the challenges of working in the medical field. We work with 3 key groups that are students on a healthcare track to get them into healthcare, professionals working in the medical field to keep them in healthcare and medical facilities. Now let's dive a little deeper on how we benefit each group. Students can download Medsembly for free in the app stores, where they can network with peers, find mentors to help achieve their career goals, and access real-life learning content, not just textbook medicine. Professionals can access Medsembly through their employer, where we have an integrated focus on community building with recognition and connectivity tools, well-being with wellness check-ins and peer support groups for burnout and workplace challenges, and personalized learning and mentorship based on areas of growth and level of experience. Employers that purchase Medsembly to support their frontline team can utilize a dashboard to monitor their impact, as well as gain valuable insights on users' experiences, needs, and challenges to help guide decisions and resource allocations. Since launching last April, we have grown with nearly 5,000 students on Medsembly with the help of our 20 strategic partners at college clubs such as schools at Ohio State, Virginia Tech, and UT Dallas, and recently secured our first B2B paid pilot. Our primary revenue model is the B2B2C SaaS model, working with medical facilities and health systems, starting with their first 100 employees at just $1,000 a month. This is a $10 billion global market, but our primary focus will be in the United States, which is a $1 billion market and projected to grow 7% by the year 2030. Unlike our competitors, Medsembly is created for healthcare workers and made for healthcare workers, creating a tailored experience based on our deep understanding of the unique needs of healthcare students and professionals. So I already told you all about myself. Now let me share more about the rest of our team. Justice, our head of engineering, has been in tech for over a decade, working with both small businesses and venture-backed companies. And Mark, our head of product, has been in tech for 12 years, designing data-driven products. We are also grateful to be backed and supported by organizations such as Atlanta Tech Village, Techstars, Goody Nation, Generator, the Women's Entrepreneurship Initiative of Atlanta, and now CUNY, Firefly, and Collab. Healthcare cannot sustain without our healthcare workers. A world with Medsembly means improved patient care, healthier work environments, and a more sustainable healthcare system. That's why we'd love your support as we build Medsembly and continue to pilot our solution and are seeking intros to HR leaders at medical facilities and health systems. And we thank you so much for this opportunity and ask you to follow us along on this journey as we shape and change the future of healthcare.
Thank you so much, Rodolin. Fantastic presentation. And please, anybody, please scan the QR code and connect with Rodolin going forward. We're just going to go straight into our first judge Q&A. We have Erica Frankel from Health Design ED. She's the managing director there. Erica, you can start to take yourself on too. Okay, see you there. Thanks a lot for joining us.
Thank you, Rodolin. And Health Design as a title obscures the reality that I'm based at Emory University. So we are very excited for another ATL-based health tech company, and great presentation. I know it's not easy to go first, so well done. And goodness, is this just an enormous and ever-present reality for us. And so I think I have many questions. And I think they sort of are connected, the main two that I have. I hear about your mentioning of the lack of support and burnout as reasons people are leaving. And I wonder about the other factor, particularly for the allied professionals that you mentioned around income, right? What are the pay rates that folks that are working tirelessly getting? And I think that's tied to my other question, which I think is a bigger one, which is how prepared are the systems you're working with to absorb the data they're getting on the well-being check-ins to respond, right? They know that things are bad, but what tools do they have, or are you working with them to develop to intervene and actually improve the situation in a cost-effective way?
Yes, thank you so much, Erica, for being a judge and being here. And the question, great question. In terms of how prepared facilities are for to basically address the data that we provide. Okay. Oh, it's on mute.
Sorry about that. How are you ensuring that the tool that you're giving them doesn't simply amplify what they already kind of know and try and kind of forget or try to tweak on the margins, but actually helps them intervene in a way that prevents folks from leaving, which is ultimately their goal. And I think I tie that somewhat in my mind, maybe it's a leading question, so tell me if I'm wrong, to figuring out the appropriate pay rates for folks who are burnt out and feeling underpaid.
Yes. Well, in terms of how prepared they are, they definitely there's a lot of different wellness tools that employees may not necessarily know about. What we do is in terms of our wellness check-in, they complete a small, short assessment, and then we give them their risk of burnout, and employers can use that and have a greater understanding of like the risk of burnout of their, the average of their employees, as well as the employee understanding that. And then we give them recommendations for what we suggest that they do, utilizing both resources that the employer has and resources that we also can offer to the employer as well. We're still learning about like their preparation for decision making in terms of like evaluating the data that we will provide, but we are working closely with them to address that. I answered your question.
Thank you so much, Erica, for your question. Thank you, Rodolin. One more question from Amy Blizzard of KPMG, the manager of the Innovation Lab. Amy, thank you so much for joining us.
Yeah, thank you. And Rodolin, thank you so much for that awesome presentation. Really, really exciting to see what Medsembly is working on. And I just had a quick question. I noticed in your presentation, I loved how you shared sort of like the qualitative data, right? Several quotes around impact, but I'm wondering about your ideas in terms of measuring outcomes in terms of like healthcare worker support and recruitment and retention. How the app impacts that. What are your ideas going forward for that?
Yes, we will definitely. Part of the piloting is to compare the outcomes of users that are using Medsembly versus those that are just not using Medsembly. That's what we're initially piloting with. And in terms of measuring the outcome of that, we use different KPIs to measure that, such as their engagement level, their wellness score, how they're engaging with their peer support groups, and as well as the other key, those that have been matched with the mentors, the outcomes of that, how they, of course, doing net promoter scores as well. So that's how we're, utilizing some data to gauge their retention, and then from there, seeing like how many of the pilot employees were able to stay versus the ones that weren't, or turned over versus ones that didn't turn over.
Okay, awesome. Thank you so much.
Yeah.
Thank you so much for your question, Amy. Thank you, Rodolin, for your great presentation, great work you're doing, and the Q&A here. Thank you so much.
Thank you. Thank you, everyone.